Hello, and welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I have Miss Jillian Warwick. Welcome, Jillian.
Thank you. Thank you for having me, Lisa.
I'm so excited to finally have you on the podcast. Jillian has been working with us. Is this your sixth year?
Yeah, I think I'm into my seventh, I think.
Yeah, going into the seventh year of working here at Back to Normal. And she's an integrative health practitioner with many talents and specialties, in particular, really looking at, lifestyle habits, nutrition, supplement, hormones, blood work, kind of tying all these things together for our patients to really help us get our best outcome. So I'm excited for you to kind of share with our audience your story, how you kind of, came into this profession, because she is a jack of all trades, and she does all of our marketing as well. So she's excellent at graphics design and content, writing blogs, etc. So, and helping us with our website. So I know that that was originally what you did, and then eventually found your way, into this healthcare space. So why don't you go ahead and just, tell our audience a little bit about you, your background, and your journey.
Great, thank you. Yes, you're right. I am a Jill of all trades, I think is what I would say now.
That's true. Yes, I should have thought of that.
It's okay. I am a comedian on the side too, apparently. No, for me, like you said, I was started off out of school as a graphic designer, kind of web content, all the things. And I just didn't feel excited about that because my health journey started when I was a kid. I had lots of digestive issues that became, during the kind of menstrual cycle times. When we get that, I started having hormonal imbalances, skin issues, eating disorder. And it just kind of spiraled. And I thought, I just kind of ignored it for a long time. And then finally I probably went to about 15 doctors from the age of 16 till 25. Mm-hmm. And no doctor would send me, they're like, your labs look great. And I did all the different weird testing and poking and prodding and, scans. And it was like, I got zero answers, except at the end, I had someone tell me that it was in my head and I needed to take some sort of antidepressant. So I just got really frustrated. And in the meantime, I'm doing, what I'm good at skill wise with the whole graphic design thing, just not really loving it though. And as soon as I found a holistic practitioner at the age of 25 who really explained to me what was happening in my body, and it educated me and then gave me dietary input. Really holistic, and things just turned around quickly to the point where I just couldn't believe that I had been, not given any of this information for years, for over 10 years. Right. And I thought there's got to be something better, so I started digging in myself. I was like, I'm a very, I'm a curious person. I want to learn. I want to know the root cause of things and why things are happening. And so I was able to really heal, in so many ways that didn't require medication. And that got me on my journey. I thought, this is something I am so passionate about. I get excited with, working with people one-on-one. And so I started taking different sort of, clinical educations, mentorships, programs, you name it. And I started with nutrition. I loved it. But then I was like, there's something more here. Just nutrition is great. It's important. It's a foundation, but there's other stuff happening. And that's when I got into gut health and really went down that rabbit hole. And then after that, I started realizing gut health impacts hormones. And hormones are not just what we think of as estrogen, progesterone, testosterone. It's also insulin hormone. There's other hormones that we don't think about, like cortisol, the stress hormone. So then I got into hormone health. And I also was like, labs do matter. We do want some data. And so I got very well trained in, running certain labs, functional labs, reading blood work to the point where it's not just you're in a range high, low. It's, you're not in a disease state yet. So we want to make sure that we're doing preventive care. So I help people read their labs. I run their labs if they need it run, and just really go down the rabbit hole with them and educate them so that I can take them through that, system-wide affect in their body and take a root cause approach in my practice to help them optimize their health with nutrition, with the labs, with the supplementation if needed. and, working in conjunction with their doctors so that it's not just a all or nothing, you're holistic or you're conventional. So that's kind of a quick overview of where I came from and what I'm doing now and why.
Okay, well, yeah, look, it's much more than just nutritional therapy, right? Supplements and food are certainly, a cornerstone, of wow, like we know how impactful that is. But putting all these pieces together is really, at least what I've seen in my clients, can be super frustrating for them, going from doctor to doctor, this specialist, that specialist, and them just getting medications or told, like you said, live with it, it's in your head, you're getting older, whatever, the excuse is, but not really coming up with a solution. And I think working with you, all these years, I mean, after being on the tour, I knew how important like all these factors were in helping somebody heal. And, that's why, at Back to Normal Whole Body Healing is really our main, goal with our patients. So let's talk about your role at Back to Normal and how how you're integrating what you do to help our clients get, their optimal outcomes.
Sure, yeah. I mean, in Back to Normal, you do take all of that whole body healing into consideration. And so when someone works with you guys in the clinic or in the studio, they're getting so much hands-on, to optimize their movement patterns, their stress responses, not just, oh, you have an injury, but like, why do you have the injury? Where is it coming from? What's the story behind that? And you get them so far with that. But what I think has been so impactful is just because we take a team approach, it's really important to have someone who can, come in from a third party almost, or maybe it's more than just one other person looking at, okay, what else is impacting this? So we've got maybe inflammation that's going on in the body somewhere, creating more pain that is impeding their nervous system. If they're in this like fight or flight stress response, and it's coming from something they never thought was there. For instance, like gut health is a great example. Gut health is something that when I explain it to someone I'm working with, it's like, just because you don't feel something happening or you're having pretty good poops every day, there can be kind of a little army going on, fighting in your gut that's causing other types of inflammation. And we know that by, plenty of research and studies out there. So someone like myself coming in and saying, let me see your labs, let me see what you've already had done with your doctor. Let me see what I can identify. Maybe there's some things that we're missing. Let's consider if we need to do a stool panel or we need to do a hormone panel that looks more at the brain as well, the brain axis, HPA axis dysfunction. That's just an example of how, I can come in and sort of be that support, part of that support team. And, when I work with the clients there, it's, first of all, they get a free consult with me because that's part of the whole picture. When they come in the door, they get top to tail, overview of their health. So with me, just kind of having that conversation and listening to what they've been going through for years and say, okay, here's some pattern recognition. That's kind of part of the process. It's like, from a clinical viewpoint, it's about pattern assessment to help someone get the best outcomes, because any of us might be missing one little thing, but as a team, we can really start working and pinpointing the things that need to be addressed, like top of mind.
Yeah, I mean, it's so true. And just, sitting and asking some of these questions, whether it be in our evaluation, helping to identify those areas where they could benefit from some expertise that you offer. And, with every new patient that comes in, they get a free 15-minute call with you that really can be used, for, a variety of subjects. And we try to help them identify whether it be sleep, it be stress, how stress, heart rate variability is impacting, things that, we're identifying, maybe irritabilities through diet that, can be, like you said, creating inflammation or gut imbalances, and how that's impacting their overall well-being. So I know that I've seen, my best outcomes when really the patient has embraced all those aspects and, it has chosen to kind of, take the path to work more, not only on the physical side, but on some of the things, that you work on as well. So yeah, so I love that for sure.
Yeah.
Well, excellent. Why don't we start in on, your top three valuable tips that help us or you get your best outcomes with your clients?
Yeah, yeah, I could probably talk an hour on tips, right? And that's something I love to do is just give people, even like in the 15-minute consult, no matter whether or not they want to work with me in the long run, I want to give them something to work with, some
Yes.
little nugget, whatever. And the one thing I think that needs to be, top of mind for many people in this world, in whatever profession you're in, health or not, is foundational health. So the things we're overlooking are the free stuff, first of all, like sleep, light exposure, nutrition, free is in like, obviously you have to buy food, but these things that are not go out and get the fancy lab, not go out and get the fancy gadget or supplement. But like I said, sleep, I would say is like the top one. Then, because when you optimize sleep, you are impacting more than we can even explain in this podcast. And it's so powerful. And light exposure is another one that I'm getting really excited about in the last year or two. This circadian rhythm we have, and the fact that we're just indoors all the time and we're not really getting the normal rhythm with the sun and the moon. And so light exposure from blue lights and things like that in our house, our devices, those things matter and they make a big impact on our whole body health. And then, like I said, nutrition, eating clean food, eating good food, hydration, movement, stress management, those are all foundations in my practice. So I want to start there and dial those in for people before we start jumping to the fancy stuff, the shiny objects. So that's one kind of, overarching theme here. The other thing I find that is, unfortunately, we know about diabetes, we know about pre-diabetes, and I won't even go into how the testing is so not well done in conventional medicine, but just blood sugar balance as a topic is one of the most overlooked pieces of health in mainstream care. And it's at the root of many disease states or dysfunctions. Like it is a free modality basically to make sure that you are having a good balanced blood sugar every day and every meal, and just making sure that's like the first thing you think about so that your energy is good, your digestion's up being better, your sleep is better, all the things kind of fall into place much easier when we have good blood sugar balance. And then the last thing I'll share is that, kind of speaking more to, well, I guess it's not just speaking to clinicians or practitioners, but one of my mottos in life has been and continues to be willing to learn, unlearn, and relearn. So like, be curious, make sure you're not stuck in this is my training, this is what I know, this is all it is, because it's really easy to get into the mindset. And if you're not curious about what other factors could be playing a role in your health or in someone else's health, then you might be missing some of the most important factors to help them get to the next level of health. So, I think, and this is a fourth one, even though you asked for three. I think especially with practitioners, you have to learn to meet clients where they're at, because you can come in the door with all of these fancy ideas and all these trainings and things like that, and education even. And if they're not ready, or you're not meeting them with a customized plan or customized recommendations and make it doable, no matter what the health concern or issue is, it's always about like where they came from, what that story is behind it. And we have to look at the human behind the labs or the symptoms and really say, okay, where are they right now? What are they willing to do? How motivated are they? What are the lifestyle factors that are impacting all this? And work with them on it, not just say, this is it, this way or the highway. That's not going to get them on the journey or even very far into the journey. So that's just kind of a little handful there of some of my thoughts.
I love that. I love the be curious, learn. You said learn, unlearn, and then relearn.
Yeah.
I love that. I think that's so true, because you get so, you just get so stuck in your habits. And when something new is introduced, it's kind of like, oh yeah, you try it, but you don't really, kind of unlearn those habits that are derailing your health. So I really love that. And meet clients where they're at. I say that all the time. I think that's just so critical, because not everybody is at a point where they're ready to hear something or act on something. Somebody might only want to do 2 exercises. We've certainly had clients that are like, look, I'm in my 80s, I'm not going to stop eating gluten, and that's just the way it is. And that's okay. So, all right. So what else can we do? What are you willing to do? And, just try to meet them where they're at. So yeah, I love that. I think that's super important.
And to your point, if you don't mind me interjecting, the whole thing, like I love your example of an older person. I don't care if they're 60, 70, 80, whatever. Maybe they're 20 that they're not going to give up gluten, let's say.
Right.
One of the things I like to start doing instead of removing things is say, what can we add into something? Like for that person, it might be adding in more protein or more veggies or fiber or something, instead of saying like, you have to remove this or you're never going to get anywhere.
Right.
So I just want to add that. I think it's like, let's add things sometimes versus take them away.
Absolutely. And again, just, having that conversation and meeting them where they're at, doesn't often happen in healthcare. They go to a doctor or a healthcare provider and they're like, this is what you have to do. And this is what I'm prescribing. And there's no wiggle room. And then that's oftentimes why, you don't get success and patients get frustrated and fail because again, they're just not in that place or in that mindset or just can't, for whatever reason. So it's good that we all work together to help, give them the best solutions and then guide them as they're willing to take those steps.
Yeah.
Well, I know that you have, your, particular like listeners and your clients. What do you think your clients like really appreciate about you? Can you share some advice, that you find yourself kind of saying over and over again to your clients?
Yeah. I mean, I think when I think about what clients have said to me, they just really love the fact that I go deep on topics, no matter what it is, because they can come to me and bring a topic. And if it's within my realm, obviously, of health and holistic health, I usually have some input and I may not know everything. And I'm always going to say, this is my opinion based on what I know, but it may not be, fully recognizing all of the other aspects. But I hear it over and over that they enjoy me going deeper on topics, and especially when they've gone to a lot of other doctors, let's say, and I'm not throwing doctors under the bus here. Hopefully I don't sound like that, but with our medical care system, doctors don't have time. Like they're not allowed to have the time with their patients to go deep sometimes, most of the time. And so when someone comes to me and I can go deep with them on explaining and educating, like for instance, with labs, if I run a CBC, CMP, everything, and I have kind of a custom panel, but I will sit with them for 60 to 90 minutes and just go marker by marker and say, this is what this means. This is related to that, pull together like a whole picture that runs through their entire body and then talk about like what is impacting it. What do we need to consider here to improve that? And it's true for any lab I run, but also just educating someone on literally physiology. This is what moved me into health in my own health journey and improved me, was someone saying, when you do X, Y happens. And this is how in your body. And it's like, you don't have to be a biology nerd or a chemistry nerd to understand when someone takes the time to explain it in layman's terms, or at least gives you some sort of understanding of it that is, not above your head. And it's not that I think doctors are trying to go above our heads. I think, again, it's just the lack of time and, kind of energy and bandwidth they have in that clinical setting. But I chose, by the way, I didn't say this earlier, but I chose to go the route I went in this sort of holistic, realm, because I knew I could go to med school, or I knew I could go. I was actually a microbiology major for a while. And I realized that I was going to be kind of in a little bucket where I could only say certain things. I could only, not prescribe in the medical realm, but prescribe a diet, let's say, that is in line with certain rules in the system. And I couldn't. I literally physically, could not do that. So I thought, okay, I've got to go outside of the sort of conventional norm and start practicing with people in a way that I felt was more, realistic, really. And so, that's a big deal to me. Now, outside of just what I hear in that realm from people, I do want to share kind of as, advice for listeners that is really something I keep coming back to, that I see over and over help with someone's goals. And it can be a multitude of goals, but the one thing is prioritizing protein. I don't care what camp of a diet you're in, protein is everything for healthy aging and healthy hormones and healthy blood sugar and healthy body composition and good mental cognitive health. And, you know, even satiety, like the fact that you're going to be more satiated in your diet, those things are, you know, paramount when it comes to improving health and longevity and health span. So I just want to share that I think most people are under eating protein from what I see day to day with people. And I've seen it over and over where people just increase their protein. They don't have to remove anything. They don't have to like calorie count. They just start getting more protein in at every meal or snack, and they start losing weight without doing anything else. They start feeling better in their body every day. They start moving better. You know, they sleep better. Like there's so many awesome things that come out of literally just prioritizing protein in your diet. So that's something that is just a recurrent theme right now for me. So I just want to share that as kind of a secondary little piece of advice or a thought on it.
Yeah, I think that is, you know, you and I talk about that all the time. I mean, you know, having enough muscle, both to support an injury or overall, you know, just healthy aging, you know, to make sure that you have good balance. I mean, muscle is so important. And if you don't have enough protein, then, you know, we will see that muscle deplete. And, you know, you and I both work with clients who want to lose weight, and they do that by decreasing their calories. They don't get enough protein and they lose weight on the scale. But when we put them on the InBody, they're actually losing muscle. And I've seen this in several patients who we've kept track, and they just wanted to do their way of eliminating calories as a, you know, and not necessarily increasing the protein. And they all ended up decreasing, you know, their muscle mass. And that, you know, is going to, you know, definitely create problems, you know, down the road, both with recovery from an injury, or, you know, just like, you know, balance and, you know, strength and being able to like use your legs and your arms, and then, you know, straining your neck and your back and things like that. So yeah.
Another thing about the protein piece and just relating it to muscle, I love the way Dr. Gabrielle Lyon calls it the organ of longevity. She says that muscle is the organ of longevity because it actually releases its own hormones in our body. I won't go into like the details, but look her up if you don't know of her. Gabrielle Lyon, incredible. So she worked with geriatric patients for years and saw the downfall of when you are losing muscle mass, sarcopenic. It's not a matter of if, but when. You are losing it. We all are. And so we have to do everything we can to preserve muscle on our body. And it also helps with our bone strength. So, you know, health is a long game, obviously. And no matter whether you're 20 or 30 or 40 or 50, you can now be doing things to help you, you know, stay the course through your 80s, 90s, and beyond. But it's just an overlooked piece, I think. And it's going to become more and more, you know, top of mind, and you're going to hear more about this conversation, I believe, in the next year or two in mainstream media, and protein being such a key piece of healthy aging. But like you said, if you go into the hospital because you have a fall or you have an injury or you have some other terrible thing happen in your health and you're in your 60s, 70s, 80s, you are losing muscle daily, just laying there. And so you've got to hold on to that and build it up and keep it strong as much as you can. And it's not just, of course, lifting weights helps, getting this resistance training in there is great, but even just eating sufficient protein can help you maintain your lean muscle mass on your body. So,
yeah. And, you know, I think for our vegan, you know, clients out there, you know, or audience that are listening, you know, this doesn't mean you have to eat like red meat or chicken or fit. There are lots of different ways to get good quality protein into your diet. And I think, you know, amongst many things that you are outstanding in, being a resource for our clients to be able to navigate all the products and all the different sources that are out there, whether it be gluten-free or, you know, being able to find, you know, they don't want dairy or they don't, you know, want animal products. You have a plethora of resources, I think, you know, that I always love tapping into, and you always find the highest quality products, and, you know, and if you don't have something, you always do due diligence, and you're searching, and you're like, let me find something. If I don't have it, I'm going to find it. And, you know, you're constantly learning and growing and trying to better yourself so you can bring, you know, these things to your clients. So I always
Thank you.
really appreciate that about you.
Thank you. Thank you. I appreciate that too.
Yeah. So one thing I wanted to touch on, just you had mentioned like the 15-minute consult. So I think let's just elaborate a little bit on what is really like, what can a client really gain in that 15 minutes? You know, you shared a few things, but you know, I always try to encourage my clients, you know, to do that session because it's so valuable. But I'd maybe like to hear, you know, you speak on, you know, what a client can really gain, or what you've seen a client really gain in those 15, you know, minutes that, you know, that you give to them.
Yeah, well, my whole goal with that is not just to sell them on working with me. It's really, you know, I start off saying, first of all, do you know what I do? Do you know what integrative health practitioners do or functional nutritionists do? And they're like, not really. So I usually start off, you know, giving them a little background on what that means and what kinds of things I work on. Sometimes I send them a little intake questionnaire ahead of time just to get a little more information on what they might be dealing with. And sometimes people fill it out and they don't, you know, it doesn't look on paper like they have anything happening. And then we talk and I pick up on things, just listening, active listening. And when they start speaking on things that I feel like might be red flags, or even just something that I think is something they can improve upon, we just talk through it. We just, you know, whether it's, oh, I am an athlete, I want to improve my performance, or, oh, I know I need to lose some weight, or my sleep is terrible, or my digestion's a little wonky. And usually I just give them some thoughts on, have you tried this? Have you tried that? I love to know who they've worked with. I like to say, you know, make sure that you're, you know, getting the proper types of testing if you're not already doing that. And sometimes they've had labs and they say, well, my doctor said my labs were fine. And I'm like, okay, well, if you'd like another look at them, because sometimes I pick up on things that are, because the way I look at labs is called, you know, optimal range, whereas it's not what the general population is. It's like, what's optimal for you so that we're getting you to your next level of health. So we talk through all kinds of things. Sometimes they just want me to give them options, like a good example, protein. This comes up like every other consult. They're like, well, I have a protein powder. Like, what's your favorite? Or what do you think of this protein powder? And I'll say this to the listeners today, actually, because I love sharing just knowledge. I'm not anti any, you know, diet. Like vegan's fine. You know, it's whatever works for you. If it's working for you, great. You know, that's important. Now, for protein powders, some people choose plant-based, some people choose more animal-based. And the main thing is, unfortunately, there have been studies not too long ago of, you know, the top 20 protein powders at your local health food store. So you'd think they would be the best choices. And multiple ones come up with heavy metals in them, pesticides in them, you know, all kinds of toxins basically in these powders that are even organic. And so we have to know and do our due diligence or research or work with someone who has, to say that's something that could actually be harming your health in the long run. And let's make sure we swap it for a better one. So I'll give them, like, here's the brands I like, you know, you can find it here. And so that's really where we end up going most of the time in that consult. And if they are already saying, look, I have X, Y, Z issues, like, for instance, ongoing gut health problems, and they know it, they're not having good bowel movements, they have bloating, gas, whatever, constipation, then I say, have you considered doing more of like a functional medicine realm stool test? And if so, you know, let's talk about what that looks like, what kind of information we're going to get out of it, and make sure if you don't do it with me and you do it with someone else, please be sure that they know what they're talking about and how to interpret it, because you can run all the labs. It's easy. Even people these days can run their own labs. You know, they can order them direct from plenty of companies. But if you have no idea, or the person you're working with is not well versed or experienced in interpreting it to give you the best, you know, input on it, it's a waste of your money, and it could be doing more harm than good. So typically my whole thing in that 15 minutes is, tell me what you want to know and I'll give you my best thoughts on it. And then also let's troubleshoot what the next best step might be for you. So.
Yeah. Well, I know many of my clients find it, you know, super valuable. and often go on, to do one-on-one, work with you so they can, tackle some of these challenges that frankly, they either can't do on their own or they haven't been able to accomplish, with other practitioners. So, again, just love having you, as a resource in our practice. So it's excellent. Thank you. Is there anything else of value you'd like to offer to our audience?
Well, I think as we know, the most valuable resource we all have is time. And that's, maybe it's not just my opinion, but in general, I think time is one of those things that we can't get back. And it's important to not take steps forward in a way that maybe isn't going to get us somewhere we want to go as quickly. So that 15-minute consult with me could be a jumping off point for you to either learn where to find what you need, or to work with me, in more in depth. And so that's what my biggest valuable resource is at this time for people, is that complimentary 15 minutes, which usually ends up being 20 or 30, to be honest. But I don't, as you can tell, I like to talk. So, and, I want to make sure that we're not just jumping in and off a call that's, kind of a waste of their time as well, because it is important. So that would be the best way that, you could get some free or some valuable input from me in that 15 minutes together. So if someone wants to schedule that, they can easily go to the Back to Normal website and get in touch with us there, or they can call the office and schedule that. I have a scheduler link that we can put in the show notes, backtonormalpt.com/integrative-consult. But again, if that's too much or you don't feel like dealing with that, totally can call the office and just reach out, and we have an amazing staff that will help you schedule that time with me.
Awesome. I love that. I think anybody who's listening, it is such a great opportunity. I would highly encourage you to take full advantage of it. I've worked with Jillian not only, in my practice with my patients, but also personally. And she, again, is just such a great resource. So thank you for always being available and sharing your insight. I appreciate that. So people basically can find you on our Back to Normal website. And so we will definitely put that also in the show notes. And again, they can either call, or we'll have a link if they'd like to book their free 15-minute consult.
Yeah, wonderful. And yes, you don't have to be an immediate, current patient at Back to Normal to work, to work with me, or to at least have that consult with me. It is open to whomever is hearing this at this point. So
excellent. Well, thank you again for your time. And until next time, keep getting great outcomes.
Thank you.